everyone, it's Frankie here from AMAC Chiropractic. How's it all going on lockdown? I think this is coming to the end of the second week now. I think it's Friday, not entirely sure what day of the week it is. But I wanted to share with you some tips on how you can kind of treat yourself. Particularly if you've been working at home from, the dining table or the sofa. I imagine things are starting to get pretty tight up through the neck muscles, maybe even developing a few little tension headaches as well. So there's a few techniques I want to give you today to work on 4 particular muscles that will help to reduce any of that tension that you're getting through the neck and possible headaches as well. One thing I want to point out is be careful when you're working around your own neck or working on somebody else's. Only ever work one side of the neck at a time. You've got some really important blood vessels running through here. So if you work both sides at the time, you have a risk of stopping the blood flow to the brain, which is a really important organ in keeping you alive. So only work one side at a time. And be careful if you're starting to get any pins and needles, or if it's ridiculously painful, stop what you're doing. Your body's telling you something, so listen to that, okay? The first muscle we're going to work on today is the scalenes. So they kind of sit here. You can just about see it above my collarbone and run up all the way in the anterior part of the neck through here. Now, they will quite often refer headaches, and kind of if we're stuck in this forward head position, they're going to be under a lot of strain and tension. So what I want you to do, just feel above your collarbone and you'll feel that there's some real tight areas, a bit like elastic bands, and I can feel there's one just here, okay? If I start to feel my pulse, I know I'm on my carotid artery. But you should just find a real tender spot through there. So what we're going to do is a tack and floss technique. So you're just literally going to put a little bit of pressure. You can see I'm not putting that much. And what I'm going to do now is turn my head away from the muscle and tilt it back. So I'm creating a stretch underneath the point that I've just tacked down with my finger. I'm going to come back and we're going to continue to do that 6 or 7 times to help release that point there in the muscle. And you've probably, if you've had some treatment with me, and you've had some neck pain problems, I've probably done this technique on you myself. So you can do this one at home, okay? That's to do the scalenes at the front. The next muscle I want to work on is the SCM. So you can see it's this one here that runs sort of from the back of the mastoid, attaching to your sternum and your collarbone, hence SCM. Now this is another really good one you can do because it's quite a chunky muscle. You can get a good old pinch of it like so. So I'm literally pinching it between my thumb and my index finger there. And I'm just going to take hold of that muscle and hold, and oh yes, that's a nice release. This muscle will classically send headaches around behind the eyes, so that's where I'm getting a bit of referral right now. So I'm going to hold that there for about 20 to 30 seconds, just to let that release off. And yeah, that's starting to give in now, which is really nice. Good. So that's for the SCM muscle. Quite often we can get headaches at the back of our head, and we've got a group of muscles through here called the suboccipitals. They're very small muscles which attach from the base of the skull to the first and second vertebra, and they're kind of really important with nodding movements of the head. So if you're stuck down looking at a laptop all day, you can see how these are going to get pretty tight. What I want you to do is find the base of your skull where it kind of meets with your neck, and you can use your thumb to find little bits of muscle through here and a tender point. So all you're going to do is apply some pressure through that area. Again, hold for about 20 to 30 seconds until you feel the muscle release. These muscles will classically refer headaches around to the back of the head and sometimes around to the front as well. The last muscle I want to work on are the upper traps muscles. So we tend to be quite tense. If our heads are forward and we're working at the desk, the upper trapezius is one of those muscles that really classically causes headaches. Tends to go up the back of the neck, around the ear, or kind of into the temples. For this, what I like to use is a spiky ball. I have one here. It takes a bit of practice to get control using it. If you're struggling, find yourself a long sock, drop it to the end of the long sock, and you can sling it over your shoulder to get it in the right place. I'm just going to demonstrate against the wall. So what I want to do is place it just around the shoulder blade like that. I'm going to come up against the wall, like so, and I'm going to lean. I'm actually going to roll around very gently through there, helping to release the muscle off. And you can then lower the ball and I'll work on a slightly different area. And spend a couple of minutes rolling around on your upper trapezius. So those are my 4 tips for today, working on anterior scalenes, SCM, suboccipitals, and your upper traps muscles. give it a go. Drop me some comments if you like that, or if there's anything else you want me to focus on, please let me know. Take care everyone, stay safe, stay well and stay at home.